Well, welcome everyone. This is Sarah Munson from Casey Family Programs, and we're so pleased that all of you could join us for today's webinar titled Opportunity to Provide Feedback on the Family First Prevention Services Act Clearinghouse for Evidence-Based Practices. Today, you'll be hearing from Casey leadership regarding considerations for the Federal Register request for public comments. Before we get started, I wanted to let you know a couple of things. We've muted all of your lines to reduce disruptions because we'll be recording the webinar to make sure that it's available for those who can't join us today. You are encouraged to pose questions throughout our hour together in the Q&A on the Zoom platform. In order to do so, simply select Questions and Answers button at the bottom, type in your question, and hit send. If you happen to be attending by phone connection only, you can feel free to email your questions directly to me at kmresources@casey.org, and I'll be sure to add them to our running list. We're going to be collecting your questions throughout our time today, and we'll do our best to answer them, either immediately or in the Q&A portion at the end. If we don't get to your question because we run out of time, we'll be sure to provide answers in a follow-up that we'll send out to all registrants and participants, along with a recording and some other resources that we'll share with you at the end of the webinar as well. On the next slide, you can hopefully join me in giving a warm welcome to our Casey Family Programs presenters today. We're joined by Barbara Pryor, who's a Senior Director on Casey's Public Policy team, Julian Chang, who leads our Knowledge Management team, and Peter Pecora, who's the Managing Director of our Research Services team. Today, on the next slide, as you can see, we're hoping to help inform some of the discussions that you may be having about whether to submit comments in response to the Federal Register notice. And for those that choose to do so, we hope to be highlighting some of the areas for potential consideration and offering some resources and tools that may help support submission of comments. First, Barbara Pryor with Casey's Public Policy team is going to set the stage for the conversation today, and she'll be providing some key highlights and background on Family First and the Federal Register notice. Barbara?
Hey there, this is Barbara Pryor from Washington, D.C., and I want to thank everybody for spending some of their Friday afternoon with us. Before we dig down into the specifics of the federal notice, I thought it would be good to talk a little bit about Family First Prevention Services Act, because it is a big, bold bill that has a lot of provisions for us to think about and a lot of opportunity for states. And then after we get a sense of the big bill, Ju will talk about this specific opportunity on evidence-based programs. And I will, and then Peter will walk us through all of the big provisions. This bill was passed in the Bipartisan Budget Act on February 9th, 2018. It provides new options for states and tribes with direct service to claim Title IV-E funds for prevention activities as early as October 1, 2019. It also creates new policy to ensure appropriate placements for children in foster care as early as October 1, 2019. And there's a lot of other new funding and reauthorizations of existing programs in the child welfare space for prevention funding, for the court improvement funding, and for specific substance abuse prevention funding, and some improvements on the Chafee program, which we won't go into because they're not relevant to the notice, but I just wanted to take the chance to highlight. The big opportunities, though, of this bill, I think, are best understood when we compare it to the time before the law. Most of the federal funding was just for foster care. It was billions of dollars. Now there is a new funding stream being created for prevention services that will be an entitlement funding stream, so it's consistent and states can count on it and build programs around it. Before this law, all the services were only focused on the child after the trauma of removal. With this law, the new prevention services will serve parents and children When I say parents, it's both birth parents and adoptive parents and kinship providers who are serving as parents. For budget people on the line, there was an income test in the past for all foster care maintenance payments, and that test is still there for foster care maintenance payments. But for these new prevention services, no income test. It's just what the at-risk family needs for both the child and parent. So all the kids can be served regardless of their family income. And for your budget people, that means no cost allocation for these new services. In the past, we've had some really good grant programs for kinship navigators, but it wasn't a consistent funding stream. Under this new law, kinship navigators that become evidence-based and qualify as evidence-based will have the opportunity to get a 50% reimbursement for all their activities going forward. So that's something that means you can build a kinship navigator program and know that you're going to have consistent funding going forward to maintain that program. And given what we know about all the kinship placements that are stepping up in the midst of the opioid crisis, it's pretty exciting. In the past, there was no funding for a child placed with a parent in a residential treatment center at the federal level. Under this new law, such treatment facilities can get up to 12 months of federal funding maintenance payments for those children in that facility, which is pretty exciting given what we know about that facility. So let's spend a little bit of time on the new funding for prevention activities. Who gets or who's eligible for the money? Children who are at imminent risk of placement in foster care and their parents and kinship providers. So we're going to serve the whole family with these new services instead of just the child. There's also a very specific provision to say that any pregnant and parenting youth in foster care are eligible. And there are no income asset tests for these new prevention services. It defines the eligible children as imminent risk for foster care. What do these people get? It allows evidence-based services to be reimbursed for 3 areas: mental health, substance abuse, and in-home parenting skill-based training. And that includes parent skill training, parent education, and individual and family counseling. These evidence-based services are limited to a 12-month period per episode, but a family over the lifetime of the child could come in to receive different services at different times based on the need of the child. And again, no income asset test for this. And if we think about how we know kids come into foster care, substance abuse, in-home parenting skills, and mental health are among the top reasons that kids come into foster care. What are the services and what are the rules around these new services for funding? On the next slide. First, they have to be evidence-based in a range of promising, supported, or well-supported. And in order for states to participate in this new plan, the state is going to have to submit a prevention service program plan as part of their 4E plan. Now, we're going to spend a lot of time on promising, supported, and well-supported because that's what the specific question of the Federal Register notice is about. So I'm going to defer some of those to my colleagues later on. But let's talk about the financial value for states of this program on the next slide. The reimbursement rates for prevention activities, if states pick up this option on October 1, 2019, will be 50%. On October 1, 2026, the state will be eligible for the FMAP rate. And that rate is anywhere from 50% to 70%, depending on the state's fiscal issues. And it's also known as the Medicaid matching rate. So that means over time, states are going to be eligible for more money on these new prevention services. Another requirement for the prevention services is at least 50% of the spending on every year has to be for well-supported practices. Remember, the previous slide talked about promising, supported, and well-supported. Half of the money needs to go to well-supported, but the other half can be distributed to promising and supported practices. The other thing that I think is important for states to realize is those states, when they opt into this new prevention program, not only do they get money for the services, they can claim 4E reimbursement for both the admin costs and the training costs at the 50% level. And just like the services, these costs are delinked from AFDC. So there's no income test, nor is there any rationale for cost allocation. And when you put that all together, a new consistent stream for prevention services, which will increase in value over time, I think it's really worth states to take some time, figure out this program, and comment on what they need and want from the Federal Register notice. Next slide is about the request for comments. And don't worry, we're going to send out all these slides after the webinar, so you don't have to write this all down. It'll be up on the web for you to refer to. The deadline, though, is Sunday, July 22nd, so we need to go through all of these provisions so everybody understands what's at stake and what the real opportunities are to rethink your child welfare system in a way that serves families as a whole and allows you to focus on prevention in the key areas of substance abuse, mental health, and in-home parenting. And with that, I'm going to let my colleague, Ju, walk you through a little bit more detail.
Great, thanks, Barbara. Good afternoon, everyone. Again, this is Ju-Yan Chang. I'm a managing director with the knowledge management team at Casey Family Programs. I'm also pleased to be able to share with you some of my insights from the time I spent as Associate Commissioner at the Children's Bureau. What I want to do today is very quickly talk a little bit about what you have in front of you with the Federal Register notice, and really just try to amplify why this is important, why it's worthy of your time. We know that all of you are extremely busy and administrating your programs on a day-to-day basis, but this is a very unique and important opportunity for states and tribes to impact and shape what you include as part of your prevention program array under Family First. So if we go to the next slide, let me first talk a little bit about what the Children's Bureau is specifically asking for as part of this Federal Register notice. We can break that up into two categories. The first is a set of questions about internal criteria that they are going to use to identify, prioritize, and select programs to include in the pre-approved and ongoing approved list that will be available as part of the clearinghouse. And then the second real kind of bucket of things that I think the Children's Bureau is seeking here in this Federal Register notice are a list of evidence-based programs that you would want them to include in the list of programs for them to review. So these are programs that you have either used in your jurisdiction or are aware of in use in other jurisdictions that you would like to consider as part of your prevention program. However, it is important to note that the Federal Register notice and comments reflect ACF and HHS's interpretation of the law at times. But when it differs from the law, it's important to know that it isn't the law itself, right? This also isn't policy in the form of formal policy by HHS. And so if there are areas of interpretation that you have a question about, may not agree about, it's important to talk about that in addition to answering the specific questions that the Children's Bureau has asked as part of this Federal Register notice. And finally, I just wanted to point out that the Clearinghouse really is intended to serve up an illustrative list of programs and interventions that can be included as part of your prevention services under Family First. But it doesn't mean that if it's not on the list, if it's not in the Clearinghouse, that it won't be eligible for Family First funding. It's simply a pre-approved list that makes it easier for states to see what the Children's Bureau has already approved. So if we go to the next slide, I'll just give you a quick example of some of those two categories that I talked about. The first, as I said, is information about potential initial criteria that states will use, that the Children's Bureau will use to identify, approve, and prioritize eligible programs. Some of the examples that Peter will talk about in more detail include criteria like who are the target populations, what are the outcomes that the Children's Bureau is going to look at, what other ratings or priorities will the Children's Bureau use in selecting programs for review. And then the second bucket really are programs and services that might meet your needs and meet the criteria that's in the law. Again, I want to emphasize that you really should be submitting programs that you think meet the criteria and included in the law itself. If we go to the next slide, we can think about why this is so important to all of you. As Barbara mentioned, this is your chance to weigh in on what the Children's Bureau identifies, prioritizes, and reviews for inclusion in the Clearinghouse. And as we've said to many of you before, your voices really do count. The administration is seeking your input. I think it's important to share what you know from the field and how different ideas are actually realized when it's put to practice. You are the experts on your communities. You are the experts on the programs that you have experience working with. And if you believe that there are programs that should qualify for the prevention funding under Family First, it's really important that you share that information with HHS. Again, I want to highlight that there are some key differences between what the law says and some of the interpretations that are embedded in the Federal Register notice. As I mentioned, they don't necessarily explicitly ask for your comments on those distinctions, but it is an opportunity during your comment period to talk about any concerns or questions you have about distinctions that you notice. So if we go to the next slide, I'll give you one example of that distinction, and that is related to a really exciting area of funding that Barbara mentioned, and that's the Kinship Navigator program. So when you look at the law itself, Congress clearly treated the Kinship Navigator program and funding for that separately from how they talked about and described the foster care prevention services and programs. There are specific provisions that are unique to Navigator programs and are separate from prevention. However, if you look at the Federal Register notice, they seem to be combining the two categories of programs and impose similar requirements on both, which might be inconsistent with the federal law. So it's important to pay attention to both the explicit areas where they are seeking comment, as well as areas where they have made assumptions that look to be inconsistent or in addition to the law, and to give comment to that as well. And with that, I will turn it over to Peter.
Thanks, Ju. Peter, if you're on mute, you'll need to unmute yourself.
Oh, can folks hear me now?
Yes, we can. Thanks so much,
Oh, wonderful.
Peter.
Thank you. For the next two slides, we're going to highlight some aspects of the law, and then we're going to turn right back to the request for comments. So as a way of anchoring things, what we want to do is talk about the evidence standards for, which is on the next slide there, for the Act. And the evidence standards there, just to highlight a few things, the intervention has to have a book or a manual or some other available writings that specify the components of the practice protocol. And it also has to be, there has to be no empirical basis that is suggesting that the practice constitutes a risk of harm to those who are receiving it. It's that hold folks harmless in terms of its practice model. If multiple outcome studies have been conducted, the overall weight of the evidence needs to support the benefits of the practice there. And as one might imagine, the outcome measures that are being used to evaluate that intervention need to be reliable and valid. And then finally, there should be no case data suggesting that the intervention poses a risk of severe harm that might be caused by the treatment. And an example folks may think of is holding therapy that was tried a few years back with some pretty severe consequences there. We're going to discuss some additional proposed criteria from the recent Federal Register in a moment, but let's turn to the next slide. And just to get everybody on the same page, we wanted to just quickly review what are the evidence-based practice requirements in the law. And we wanted you to see how the criteria do vary by the rating level of, promising to supported to well supported. So for example, note how the law moves from requiring one study at the promising and supported levels to two studies at the well supported level. You can see that in the third column there. Note also how the follow-up study requirements shift in that there is no follow-up study required at the promising level. A 6-month follow-up study is required at the supported level for an intervention at that rating level, and then one 12-month follow-up study is required for the well-supported. So that gives you just a little sense of how the levels of evidence are, these rating levels are playing out in the law. But let's now turn to the Federal Register slide and start to get into the call for comments. As you heard Barbara and Ju mention, the Children's Bureau has chosen to propose adding requirements to what people already view as a fairly prescriptive bill. So given that the recent federal notice is a proposal, we think it would be wise if you send the Children's Bureau your comments about what you like and what you would want changed about the proposed rules. So let's quickly review 7 areas you might want to comment on. First, the law calls out children at risk of placement. The Children's Bureau is proposing to narrow the populations relevant to this law, and many folks are concerned about that. To guide this area, use the logic model, the logic of what drives placements in child welfare. So for example, we know that maternal depression can sometimes lead to child placement because of child neglect. We also know that unchecked, angry teenage behaviors can lead to child placement. We know that. A high proportion of the placements for teenagers in foster care are due to the youth behavior. So using that logic, studies about the interventions that have proven to be effective for maternal depression, parental anxiety, child acting out behavior, should be considered even if they are from behavioral health, juvenile justice, substance abuse treatment, or related fields. And those impacts, we would suggest, are very much relevant family first target outcomes. To further support that perspective, many of these interventions that are useful for child welfare were created or strengthened via research and technical assistance from the National Institute of Mental Health, National Institute of Drug Abuse, and SAMHSA, including when you think about the variety of NIDA substance abuse treatment studies that have been done, and SAMHSA's groundbreaking work for the National Child Traumatic Stress Network, their systems of care work, and their other initiatives. For issue number 2, as I just mentioned, studies about interventions that have proven to be effective for a wide variety of child welfare related problem areas should be considered. Again, from a wide variety of fields. And we believe those problem areas, substance abuse, emotional and behavioral health issues, are very much relevant family first target outcomes, because we know that if they're not addressed, these types of difficulties that parents and children are having can lead to placement. For issue number 3, John Landsberg and other experts caution that the field has not defined what a trauma-informed approach is sufficiently. And despite the excellent work of SAMHSA and the National Child Traumatic Stress Network and others, not enough work has been done to very carefully specify and define and measure what a quote-unquote trauma-informed practice entails. So because we're at this beginning stage of practice science, many folks are saying it would be important for the federal government to employ a broad view of what might be defined as trauma-informed care. Let's move to the next slide there, and we'll, for issue number 4, it's important to point out that the law does not require that the studies be published in any specific area, but the Children's Bureau has added this proposed provision in the most recent guidance. And many folks believe that the term government reports should be defined broadly, and government reports should include reports submitted to city, county, state legislature, tribal nation, or the federal government, not just the federal government. And in addition, people believe that university published reports and reports to foundations, United Ways, and other funders should be included as well, if they meet conventional research standards. You know, they're high quality. For example, a number of very important child welfare research reports have been submitted to the child welfare agencies in New York City, Illinois, and other jurisdictions. And why shouldn't reports like these on subsidized guardianship or prevention services, why shouldn't these types of reports also be considered as valid sources of information? Our 5th issue that we wanted to call out is the issue that the federal government is not considering in terms of target outcomes, access to service, satisfaction with programs, and services. And we believe that this proposed provision could have a very negative impact on kinship navigator programs, since they typically measure access to services as one of their core goals. Now, we know that kinship navigator programs are being defined as a separate provision to the Act, but we're using that as an example just to highlight the fact that access to service, in fact, may be a very important outcome for certain programs. While we know that child welfare programs really should make sure they're measuring, things like rates of child maltreatment, runaway episodes, placement disruptions, prevention of placement, et cetera. The provision or rule for this possibly could be phased in over a 3 to 4 year period of time for certain interventions where that they need more time to refine their measurement approach. Number 6 is a proposed limitation, and we want to emphasize that it's not currently in the law, but and many folks are worried about the limitations in relation to country and time period. So let's talk a little bit about that. The country restriction should probably be expanded for certain interventions. And I'll give you an example. There are certain countries in Europe that are not listed on the slide here and not listed in the provisions that have done a lot of work around medically assisted substance abuse treatment. And from our work in Florida with their Innovative Fit project and other projects, we know that medically assisted substance abuse treatment is an important dimension of substance abuse treatment for certain adults. So with that, why would we want to have studies from France or Germany excluded from the being considered by the clearinghouse? From a feasibility point of view, we understand that studies need to be in English because an HHS-funded clearinghouses and many clearinghouses depend on studies written in English. But given the percentage of Latino families being served in the child welfare population, shouldn't studies published in English but conducted in Mexico or Latin America, should those not also be considered? And then in relation to the proposed study date of 1990 onward, many people would ask that HHS consider or reconsider that if there are major studies that would be excluded if this proposed rule was enacted. For example, this would exclude the first landmark home builder study that was done in 1979. It also would exclude one of the first randomized control trial studies of nurse home visiting, where they focused on parents at risk of child abuse and neglect, which was published in 1986. To close out this section, we'll go to the slide here on number 7, and that relates to what you heard Jude talk about, which was this notion of what are potential candidates or programs for services. And we would suggest that there are a substantial number of interventions that do meet the HHS criteria under Family First. And we recommend that interventions that are rated by a variety of clearinghouses be considered to see if they meet the Family First criteria. And I think we have in a later slide coming up a large list of some of those clearinghouses for folks to consider. And I think those are the ones people will see. They're pretty primary ones there. So we would again urge that a broad perspective on which programs are eligible for Family First be considered rather than a narrow one. So we can move to the next slide. So what this final section is going to provide an overview of some key ideas to keep in mind as you consider what interventions you would like to be reimbursed for in relation to Family First and how these proposed rules might affect that. So let's move to the next slide. And so folks have worried that there would be no interventions really that would qualify for Family First reimbursement. And that's clearly not the case, as we're going to see in reviewing these next 4 slides. And we'll go through these quickly. As you know, the slide deck and the catalog will be available to you after the webinar. These are just a few of the emotional behavioral health interventions that are available. I think they should look very familiar to you, as they are well-respected interventions that are being used today in behavioral health and in child welfare. So we just wanted to list a few up there. The next slide presents some for the areas of substance abuse prevention and treatment. Now, many of us in child welfare can be frustrated because it seems that we have a limited number of choices in determining which of these interventions we can pay for or are available to us. but we wanted to at least provide you with a list of some of the more promising ones here that have had, some of which have had some extensive research. In our next slide, we just want to highlight the in-home parenting skill-based programs because there's a lot more of those to choose from. And we've just highlighted a few that states are actually using right now. And we wanted you to see just a subset from the catalog. And then finally, there are some from the in-home parent skill-based individual and family counseling area. And then you can see things there like interventions related to addressing attachment and some of the family and behavior therapy interventions that are out there that many of which have pretty extensive research. Let's move to the final section here, and we'll talk a little bit about, again, we're urging that the federal government and the HHS Clearinghouse really consider a wide variety of sources for which interventions they would consider, and this is just a sampling of some of the best clearinghouses that are out there today. And then on our next slide, I think we want to talk about the catalog. So in addition to the comment submission template that Casey Family Programs will be sharing with everyone, to help you in your planning, a team of us at Casey from Research Services and Knowledge Management built a catalog of interventions that we hope will showcase what evidence-based practices at what level of evidence already exist. Now, while not intending to be exhaustive, the catalog, and we're adding some as we revise it, the catalog does contain over 140 interventions that are relevant to Family First. Let's look at the next slide. Well, we've jokingly called this the Casey Family Program's eyesight acuity test, and it is not intended to test your eyesight, but it is a way of illustrating on this slide, and then we move to the next slide, how many programs we have found that should be eligible by category, by program category, for Family First reimbursement. So let's move to the next slide there. And this is an actual sample page from the Casey Family First Intervention Catalog. For each intervention, the following information is provided when it's available, and we include the intervention summary, as you can see on the left, the target age range of the child or the parents to be served, the problem or skill areas that are trying to be addressed, the number of sessions, the duration of the treatment, its cost, if we're able to get that, cost savings, benefit cost ratios, courtesy of the Washington State Institute of Public Policy or other sources, and the availability of a manual, which is, again, required in the law. Now, due to the importance of the Title IV waiver program, we've also designated which of these interventions were or are being implemented by a jurisdiction as part of their Title IV waiver. So that is the column on the far right. And then in the middle, you might see that level of effectiveness, effect sizes column. We're still filling in more of the effect size data, but the column does give its rating of that intervention according to the California Evidence-Based Clearinghouse for Child Welfare, using, again, their three levels of classification, which parallel very closely what the federal government is using, except their criteria vary a little bit. So we will be updating the catalog shortly in early August with the evidence-based practices that are currently rated as supported using the California Clearinghouse criteria. But if we use the Family First criteria, these interventions actually, many of them bump up to being well supported because, for example, the Family First criteria do not require a randomized control group design, whereas for one of the levels, the California Clearinghouse does. So to wrap up, we'll go to that last slide or two. And, I'll have maybe Sarah jump in there to help wrap us up with the Q&A, because she can take us through this more coherently than I can. Thank you.
Great, thanks Peter and Ju and Barbara. Before we move on to resources, were there any other clarifying comments or additions that Barbara or Ju you'd like to make before we move into resources or take folks' questions?
This is Ju. The one thing that I wanted to clarify was the issue of target population of interest. So for those of you who might have your Federal Register notice out or want to take note, this is section 2.2.2. And what HHS is saying is that they want to focus on programs that have been developed or used to target children and families involved in the child welfare system or similar populations. Now, the law does not require that they only focus on programs that have been developed or used to target child welfare populations. In fact, the law clearly says that there are 3 categories of programs: mental health programs, substance use disorder treatment programs, and parenting programs that are designed to help the child, the family, or the parent for the period of time allowed if that child is a candidate. And so this is a real narrowing of the types of programs. Some of the 140 plus programs that Peter shared in your eyesight test, what you'll notice is that many of them were not necessarily designed or used to target child welfare populations. However, they certainly meet the criteria in the law that they address mental health, substance use disorder, or parenting skills training. And so we think that this is an important difference between the law and the proposed rules in the Federal Register notice that it's important to focus on. If, however, there is going to be that prioritization, we think that it's important to think about defining similar populations to be as expansive as possible so that we can include many of these programs that we know will impact our families.
Thanks so much, Ju. Next, Barbara Pryor from our public policy team is just going to highlight some of the resources that we've compiled and will be making available to you. Barbara?
Okay, since this is a big thing and a challenge, on our Casey Public website, we're going to have the webinar recording and the PowerPoint. So you can go through all those specific points that Peter made about the areas where you want to comment. It will also give you the links and the deadline and all the specifics. We will also have another site that will have the webinar recording and PowerPoint. We're going to provide a draft template to use or adapt if you want to make your own submission. And then we're also going to allow other organizations and partners to put up their sample comments so people can see what other groups are saying about this. And if they want to kind of think about it and consider their options and support their options, that's all okay. This will be on an externate site, and you need to get permission to access it just so we can manage it. But that link will be up and available to you, and that way you can see what other groups are thinking and saying about this big proposal.
Thanks so much, Barbara, and we'll be sure to send that around at the conclusion of the webinar so you have all of that information. Now we're going to take some time for your questions. We've received quite a few questions on the webinar platform, and thanks to those of you who've emailed me questions directly, and Angie's been compiling those, and I'll ask Angie to get us started to raising some of those questions with our presenters today. Angie?
Hi, everyone. Thank you for all the questions. We did get a lot, so hopefully we can get through all of them. Anything that we don't get through, we are capturing and we'll follow up through email and all of that. So if we don't get to your question, please know that we plan on following up. So the first question, so Barbara, when you were talking about funding, there was a question about, do you mean new ways funds can be used or additional 4B, 4E dollars? And is this additional new funding for preventative services or money that has shifted from funding out of home care?
The new prevention services that need to be evidence-based for substance abuse, mental health, and in-home parenting, it's new money. And it's also Title IV-E money, which is an entitlement money. So it means it's not an appropriation, it's not capped. If the family qualifies, they can get the services. And it's important to remember on those services, it's not just 50% for the services. It's also 50% for the administration and 50% for the training, regardless of the family's income. So that's why this is such a big, bold, new opportunity for child welfare systems.
Thank you, Barbara. Another question. How are we defining children at imminent risk of entering care? Does it require an allegation to be substantiated, or does a high or very high risk score in SDM or other actuarial based tools qualify?
So this is Ju. I can get started and others should jump in. It's a question we've heard from a lot of jurisdiction leaders. We have had a couple of national and regional meetings where Commissioner Jerry Milner has participated. Our understanding is that at this point, HHS does not intend to create any additional definition to who is eligible or who is a candidate. The law does state that the child is at imminent risk of entry into out-of-home care or foster care. And the understanding at this point is that states will really be able to define that population in more detail. And I think that variability is going to be important. However, I do think people are seeking perhaps some examples of the type of ways they can define that for themselves. So some of the examples that you just listed, Angie, whether it's actuarial tools, whether it's the ability to use predictive analytics or data analytics to show which populations or which characteristics drive entry into foster care. Those are all things that states will likely negotiate with the federal government when they submit their prevention plan.
And this is Barbara for one more way to think about it. States, counties, and child welfare agencies make these decisions every day. There's not a standard, in or out for kids into foster care. It's made at the local level, which is where it should be. So it's that local level and that state level where they have the ability to determine who is at imminent risk.
Thank you, guys. So this question is about county administered states. So can you say more on the required state prevention program plan, specifically for county administered states?
So this is Ju again. I may have misunderstood the question, but just wanted to clarify that the prevention program is an option for states. It is a state option. It's not clear to me whether or not a state can opt in and phase in the prevention programs over time across counties, or whether different counties would want to work with the state to have an expansive list of evidence-based programs they would want allowed in their state, but perhaps not necessarily particularly useful in every county in the state. But again, this is a state prevention option that will likely have very different impacts in different counties.
Thank you. Is the funding for parenting skills programming limited to in-home services, or could it be included, or can it include community-based parenting groups?
It can be both. I think folks may want the federal government to add to to clarify a little bit the definitions for those clusters of services. But from our understanding, these interventions could be provided in a, in a group setting, at a local community church, in a setting in an office, and some of those that are intended to be and are clustered under in-home, those then have to be provided in-home. So the law appears to allow for a variety of services, modalities, in terms of the location of those services.
And this is Jude. Just to add to what Peter just said, the Federal Register notice does talk about the Children's Bureau interpretation of in-home services being provided in the place of residence for the parent. But as Peter was noting, some of the things that we consider parenting services or group support groups can also be mental health services or substance use disorder treatments, right? You have a lot of group therapy for those two different categories. So I think it's really important to think about which type of the three prevention services that program would fall under in order to make sure that the setting is appropriate.
Thank you both. So the next question is about kinship. So our kinship navigator programs asked to comment for Clearinghouse, for the Clearinghouse as well. And also, what does it mean to have an evidence-based kinship program? This participant wasn't seeing anything under the criteria for well-supported.
So I think it's a valid question, and one I think that we need the Children's Bureau to answer. I also think that if people have a clear point of view about whether or not kinship navigators should be approached in a separate way from the prevention programs and the evidence-based standards, this is your opportunity to state that and why that's important. Certainly there are kinship navigator programs that either are or are very close to being identified as evidence-based programs. However, I think that the spirit of the law was not to have kinship navigator programs evaluated in the same way as prevention in those three categories, but that really is up for interpretation, and this is the chance for jurisdictions and partners to weigh in on that.
And this is Barbara to add on to Drew's comments. Casey Family Programs is proud to partner with Generations United, which is one of the leading kinship advocacy groups. I know that Generations United has draft comments that they are going to share with a broad audience, and we will be sure to get those up on our extranet site. And I would just remind people, if you read the law, the kinship navigator provisions are in a separate section, and they even have a separate start date than the prevention services.
Thank you, Ju and Barbara. Next question, if a program is not in the Clearinghouse but has a very successful or has been very successful in child welfare outcomes, what are the parameters for consideration for this funding?
Well, from an evidence point of view, you'd want to make sure that those programs are getting the best evaluations that are possible and feasible. And as I think my colleagues will weigh in here and maybe elaborate on, the federal law doesn't prohibit any state or county from providing a non-rated or a promising program. It just means that, it's requiring that at least 50% of the dollars being reimbursed by Family First are spent on well-supported programs, the highest level. So states and counties are free to use, to provide and get reimbursed for Family First dollars for programs that are at a lower evidence level. It's just that there is some restriction on that federal funding if, in fact, they want to pursue that. And maybe Barbara or Ju will weigh in with some other comments on that.
Sure. This is Ju. Just to kind of add on to that, I think the question was asking also about how programs that are not on the list in the clearinghouse will be approved. It's not clear. I mean, I think the law makes it clear that states should be able to get programs not in the clearinghouse if they meet all of the evidence-based standards that are delineated in the law, should be able to be approved, and the assumption is that states would submit that as part of their prevention plan. But having said that, HHS has not provided any additional guidance on what the process would be to get those programs outside of the clearinghouse approved under the 3 categories. And as Peter noted, there is a 50% requirement that funding be focused on well-supported programs. However, all programs, in order to be eligible for federal funding under the prevention, have to fall under one of the 3, promising, supported, or well-supported.
And Barbara, just to wrap that up, if you look at the law, it also explicitly asks and directs HHS to update on a regular basis. It's not defined what regular is, but the hope is that this will be updated, because as we use more of these programs, I think the Hill leaders had hoped that the evidence base would expand and improve. So the idea in the law is that there will be an increasing list of programs as we learn more.
Okay, thank you. More of a technical question about Casey's role. So will Casey be drafting some example comments or some sample comments that folks could pull from as relevant to their states?
The comments are due on July 22nd, which is a Sunday. We will share and give partners the opportunity to share their draft comments, and we will clearly have a template up. So states or interested parties will have a very easy guide to show and to use. And I know that will be up and ready for people to look at.
Thank you, Barbara. One more question. So would funding for prevention services be available to kinship caregivers, in quotes, who are not involved with child welfare or the courts, but are providing long-term care as a result of at-risk circumstances within the family dynamic?
So this is Ju. I can start, and others can join in. I think we should think about kinship providers in 2 buckets of funding available to them. The first is if the child is a candidate. So again, the person eligible, or the person who triggers the eligibility is the child, and they are eligible if they're at imminent risk of entry into foster care. If they are, the kinship provider who's caring for them, the child themselves, and the parent are all eligible for these prevention services for up to 12 months per episode. However, the family dynamic you described about longer-term care, so certainly relatives caring for kids outside the formal system, which is what the candidates program is, can receive those prevention services, but that's time limited, right, per episode. However, this is why the Kinship Navigator program is so important, because Kinship Navigators don't have time limits. They can serve a much broader array of children and families. This is not for kids who are necessarily only for kids who are at imminent risk of entry into foster care, but for any relative caregiver. And we know that they are in the millions across the country who are safely keeping their children outside of the formal system, can receive connections and support through the Kinship Navigators program. And it's why it's so critical that we get an interpretation of the law that allows for the evidence-based standard to apply specifically to kinship navigator separate and apart from the prevention program.
Thank you so much, Ju. Well, that's all the time we have for today, unfortunately. I know we have probably about more than 50 questions that remain that we weren't able to get to today. So as we mentioned, we'll compile the remaining questions. And again, if you think of others afterwards, you can feel free to email us directly, and we'll try to share some responses on the extranet site and send those out via email. Again, I want to thank all of you for such an incredible turnout and your engagement in today's session. You can be on the lookout for a follow-up email from us with the recording and the PowerPoint along with the extranet link. And again, any answers to questions we couldn't get to today. Thanks again for your participation. We're so glad you could be with us, and we look forward to connecting with you on future webinar sessions. Have a good afternoon.